Firstly, I'd like to acknowledge the work of the Minister on this matter and her hard-working staff, especially with our pandemic response taking priority and unfortunately delaying these amendments. I'd also like to acknowledge the member for Brunswick's contribution and, of course, his clear explanation as a doctor and experiencing the sharing of medical information between facilities and what it means to the patient care outcome of many, many patients. And as he's alluded to, not all patients relay their medical history or remember their medical history or remember the drugs that they take and things like that. And in some cases, they're not even in a situation where they can actually relay any information to the medicos. They could be in an unconscious state. So it is important that this bill is clearly about patient care and better patient outcomes. And I thank the member from Brunswick for his explanation. As I say, as a doctor, he's been through those experiences before where the information could have assisted him in dealing with his patients on different occasions, and I appreciate what he's contributed. I'm also very proud to be part of the Victorian Government who continues to improve patient safety and provide continuity of care for all Victorians, making sure that our health clinicians and practitioners have at their fingertips the tools that they need and when they need it. And again, we've had it raised in this chamber that patients can be moved from facility to facility subject to the circumstance of their situation, and it is important that medical information is forwarded and shared between those facilities so the receiving hospitals can be able to, firstly, be prepared to be able to treat that patient, and secondly, to be able to deliver the best possible patient care and outcomes. So continuing to deliver on our election promises and the trust in which the Melton electorate has given me, this is an issue that in my previous life as a paramedic, I've seen firsthand the benefit that this proposed amendment to the health legislation will deliver. Ambulance Victoria have had their own system, electronic and digital system, for many, many years. It was called the VACA system, which is the Victorian Ambulance Clinical Information System, and it's been in place, as I say, for many years. This is an electronic patient care record, and the purpose of introducing that system for the ambulance service was for paramedics to put as many details and other details in regard to the situation of the patients that they're treating and transporting to hospital, and being able to send that information off to the hospital before they arrive, so the hospital has some knowledge and being able to look up a patient's history if that patient has been at that hospital previously. And that system has worked very, very well. There's been modifications of it for the ambulance service on a number of occasions to try and improve it, but it has worked very well, and I dare say it's something that's in place, and I know that the hospitals receiving that information are grateful to receive good, thorough electronic information prior to ambulances arriving, and it's important for patient outcomes. So in an emergency, when every minute counts, access to accurate and vital health records saves lives, and it's obvious that the patient electronic medical records, the EMRs, bring hospitals and health services into the 21st century, driving healthcare advances and improved treatment outcomes for patients around the state. And I'm excited that the Melton Hospital, the new Melton Hospital, when it opens its doors, is going to have access to this system, as well as having a 24-hour emergency department. It will be at least 274 beds. It'll have an intensive care unit. It'll have a maternity unit, a neonatal unit. It'll have mental health services, radiology services, ambulatory care, and, as I said before, mental health beds. It will be a full tertiary hospital. And we hear a lot of background noise from people that are naysayers about this particular hospital. These are big infrastructure builds. They take time to build. I'm pleased to say it will occur and start building as the start of next year and be completed towards the end of 28, early 29. And it'll be a great asset for the western suburbs, not just Melton, but for the western suburbs. And it completes that corridor. Western Footscray, Western Sunshine, Joan Kerner Hospital, Western Melton, Bacchus Marsh facility, and we also have a Melton medical facility right now that will be complemented by the new hospital. So, for people to say that the western suburbs have been left behind, I don't know what planet they're living on. It's certainly not the same planet that I'm living on, that's for sure. So when the Melton Hospital is operational, it will have the capacity to treat 130,000 patients each year. And it will also see 60,000 patients go through that emergency department. And we're talking about the sharing of medical records, and we're talking about 60,000 patients. A lot of those patients that will go through that emergency department will already have medical history at other facilities. And that'll be shared now with the new Melton Hospital when it's open, so those patients can be treated with up-to-date information and the sharing of that information. It's nigh on impossible to find a Victorian who has not visited more than one health service for care and treatment as a patient. And currently, as it exists, our personal health information exists in multiple silos across the multiple health services. And this bill will improve on that situation where we'll get rid of the silos and we'll be able to share that information right across the networks. So most Victorians will often be treated at different health services over their lifetimes, and patients can't know what information from their medical past will be critical to their medical future. And of course, depending on the circumstances, patients may not be able to provide all or accurate medical history. And as I said before, there can be circumstances that lead to that, subject to the incident that the patient's involved in, whether it's a medical condition, whether it's an emergency situation, whether it's a traumatic situation, whether it's drug overdose, whether it could be a serious assault, things like that. You don't always get the relevant information from your patients, and as I said, as a paramedic, it's important to try and do provisional diagnosis and treat people, but to try and get all the information, it's not always forthcoming. And some people will and I'm sure we've all been through this when you've been to your doctor. Do you tell your doctor everything that's going on? I don't think so. You tell them enough what you feel you want to tell them, but you don't tell them everything. And you do that for certain reasons, and that's an issue. That is an issue, and of course the medicos can only treat what the information they gather and what's before them in regard to signs and symptoms and the information that the patients provide. So it is important to have good medical history. It is important to share the information, and that will lead to better outcomes. But again, we all think that we're all honest when we go to the medicos and tell them everything about us, and we don't. And we do that for various reasons. Some of it could be embarrassing for us, So, and I can tell you, I've done that at my doctor's, So, no, I don't drink alcohol. I never drink alcohol, and obviously people in this chamber would refute that. But my doctor thinks I'm squeaky clean, so that's great. So, look. Over the last 20 years, health and medicine have undergone a digital revolution, and as I alluded to before, the ambulance service introduced their VACA system many, many years ago, and it's been such a success. Again, we're proven why Victoria is one of the most respected biomedical research precincts in the world. Cutting-edge research and discoveries, training some of the country's brightest minds, as well as strong economic value to Victoria. All of this medical information sharing will lead to better outcomes because of, as I say, I know with the VACA system in ambulance, they collect a lot of data in regard to pre-hospital care, and I know the minister's at the table, and it's been important data in regard to the types of incidents that they respond to, the types of treatments, the drugs that they may use, the numbers of resources that they might respond to a certain incident. What we deal with drug overdoses now is quite different to what happened in the 70s, 80s and 90s. There's quite a different response, and the medicines that they have, or the medications that they have, is quite different in dealing with these patients. So that sharing of information is really important. And as I say, if we can get the broad system right across the networks, right across the state, rather than be siloed into health networks in just the east or the south or the west, if it can broaden out right across the state where that sharing of information and with the ambulance service and with other health agencies, then it can only lead to much better outcomes for patients. And as I've said previously, this bill is about patient care, it's about better patient outcomes, it's about having enough information for the medicos to be able to treat people better. I commend this bill to the House and I thank the Minister for it.